Well, this has been the first full day of spring, which is good news for those who enjoy outdoor activities. But it also means that it is allergy season, and often it's easy to confuse the symptoms with something more serious, particularly during a pandemic. Our Mariah Gallegos explains.
People will say, well, at first I just thought it was allergies, and then they'll still go out and about in their daily activities, interacting with others until they start to get the body aches or more severe symptoms. And then they're like, wait a minute, it might be something else.
COVID-19 and allergies, similar symptoms, at least initially. Dr. Kim Onufrak with the health department says allergy season is a concern as we continue to face the pandemic.
If you have fever, if you have the body aches, you have shortness of breath, nausea, vomiting, diarrhea, those are sense of loss of taste or smell. That's typical of COVID.
Onufrak says it's important for people to monitor their symptoms so that if it is COVID, they can quarantine quickly.
Itchy, watery eyes. That's more typical of allergies than COVID. And then you start to get nasal congestion. And then from the nasal congestion, you have some mild sense of loss of taste and smell, but usually that comes back after the nasal congestion resolves or after you take your allergy medicines.
Onufrak says although in some cases it may be allergies, it doesn't hurt to treat it like COVID until you get that negative test result.
Unfortunately, our numbers are increasing again. So there is a higher likelihood of it being COVID because there are more people in the community with COVID at this time.
Mariah Gallegos, 3 News.